Today we're going to demonstrate our technique for multidirectional stabilization. This is using all knotless fixation, which is important in these patients. They tend to be smaller females with a high amount of laxity. This patient had a 360 labral tear, but also over hundreds of dislocations and subluxations anterior, posteriorly, and inferiorly. Here you can see here we're debriding the labrum and elevating it off to do a robust capsular and labral fixation. In isolated capsular laxity, you can do this without elevating the labrum. Here we're placing our first knotless fiber tack low down posteriorly. You're using a new suture lasso. This allows for ease of passage. This is a pinch and roll technique. This will add further capsular fixation. We've had excellent results in these patients when they're eventually indicated for surgery. Here we're passing it through, pulling it out without having to do it outside the cannula. This allows for quick passage. We engage the knotless fiber tack. You can see we get robust capsular fixation and tightening, and we remake the inferior glenohumeral ligament. We're doing again another pinch and roll technique. This allows us to do interrupted sutures in this situation. Here we're grabbing through the lasso, pulling the suture out the cannula without having to pass it outside the cannula, and this speeds up the procedure significantly and improves the overall fixation. You can see here we're placing our third knotless anchor. We've also repaired the superior labrum, which had laxity as well and tearing. Again, pinch and roll technique with the new suture rotational lasso. And this allows for folding of the labrum capsule to get this to scar back down together. Here we're going through, pulling the suture out. This allows for quick passage of this knotless fiber tack suture, and the pinch technique allows for more robustness. Again, making sure there are no tangles when you put this down, prevent any catching of the lock mechanism, as these are quite small sutures overall, 1.8 millimeters. We've engaged, now you see we've repaired the posterior aspect. We've already closed down the shoulder significantly. This is a low inferior anchor anteriorly. And then we're doing a pinch and roll technique again. We're passing through the anterior portion of the inferior glenohumeral ligament to remake this and retighten it to reduce any further subluxations and dislocations in this patient. This patient of note had over 100 anterior and posterior subluxations / dislocations. You can see we've passed through. This makes it very quick for passage of the suture. This is the repair suture being engaged. And anteriorly, we will save these sutures and retension. We do another pinch and roll technique and a pass through using the rotational lasso. You can see the ease of this device. And then we'll engage it. And you can see because of the pinch and roll technique, we are really adding robustness to the anterior fixation as well. We'll pull this out the back and repeat this one more time with the pinch and roll technique. We've had excellent results in these patients with extremely low failure rates. And as you may know, this is a challenging patient population. Again, we're tensioning this and engaging the knotless function. This can be done quite swiftly in the operating room if following these steps correctly. We retension the first one. We'll retension starting from inferiorly to superiorly. You can see we have excellent fixation superiorly, anteriorly, and inferiorly, as well as posteriorly. And then you can actually use the rotational lasso to pass through and repair the posterior capsular rent. We pass a suture tape, and then we use a bird beak on the other side. And then we do alternating half hitches to tie the capsule to prevent any further laxity. Thank you.